I'm Adam Siladi with the eClinicalWorks podcast. Now, the healthcare industry is always changing, so to stay on top of that, we decided to speak with John Lynn, who runs Healthcarescene.com, which is a collection of blogs talking about all sorts of things with the healthcare industry in general. So stay tuned for our interview. Now, it's going to be a two-part interview, so after this portion, be sure to stay tuned. Take a look. I'm Adam Siladi with the eClinicalWorks podcast, and today we have John Lynn from Healthcarescene.com to speak with us. John, thanks for being here. Tell us a little bit about Healthcarescene.com.
Sure. So Healthcarescene.com is a network of about 10 healthcare IT blogs that we've created over the last 11 years. We actually just are approaching 11,000 blog posts over 11 years. So we've created a lot of content over that time period. But along with that, we also, we create great healthcare IT content for sure. But then along with that, we've also expanded to doing careers at Healthcare IT Central. So we have a full job board there for those interested in the health IT career space. And then we, 3 years ago, launched the Health IT Marketing and PR Conference, which you can find the conference in the community at hitmc.com, which really focuses on how do we get these great technologies, these great solutions out to healthcare, and so that they're getting in the hands of the people, and we actually improve healthcare, because so many people have great solutions and a lot of people don't know about it. So we need to get the word out. So that's really the Healthcare IT Marketing Conference, and all synergistically works around healthcarescene.com.
So John, one topic being talked about today is the doctor-patient relationship, and there are lots of efforts to strengthen that relationship in the case of patient-centered medical home, to modernize it, with the focus of electronic access and using telemedicine and wearable devices and things like that. What's kind of the prevailing opinion that you've seen on patient engagement?
Well, I think the real challenge is that there's two ways to look at patient engagement. From the one perspective, you have the regulatory compliance version of patient engagement that we largely call meaningful use. And I think that most providers and even most patients don't consider that very meaningful. And so there hasn't been a huge uptick in adoption of those things. Certainly they did enough to meet the meaningful use requirements, but it didn't really change the physician-patient relationship in any meaningful way. So unfortunately, that's what the regulations required, so they did it. But I think going beyond that, we're seeing a transformation of what patients want from their doctors and what doctors provide the patient. And this is being influenced by a number of factors. The leading one is largely that patients are paying for more of their health care through high deductible plans, through their employer not covering everything that they need to, and so the patient's being more responsible for their care. And as the patient becomes more responsible for their care, they start to care what type of interaction they have with their doctor. And kind of piggybacking those is other movements such as the direct primary care or the concierge model, which is becoming very popular. And also we see the telemedicine, which is extremely convenient for patients. We all want to do that. I mean, who wants to drag their children into the pediatrician to see the doctor? It's a miserable experience, and telemedicine is way better for that. The problem with that is that for many doctors, it doesn't change their experience at all. They're still spending more or less the same time with the patient. So on the patient side, it's a huge benefit. On the doctor side, it's a challenging benefit, and in many cases, it doesn't get reimbursed, although we're seeing changes around that as well. But I think at the end of the day, doctors want meaningful engagement with patients. Patients are starting to demand it, and it's going to go well beyond what the compliance requirements are.
So it sounds like it's something that both sides want, but there are some external pressures that maybe make that a little frustrating at the time that we find ourselves in now. So let's talk about, we'll get into that a little bit more about, the payoffs and things like that we've seen and that you've seen. But let's talk about some of those capabilities. Like, what do you think are some defining capabilities of patient engagement today and in the future?
I think there's a whole suite of capabilities that are going to need to be addressed in order to make this happen. And in fact, in the accountable care world, right, the value-based reimbursement world, you're going to have to create a whole suite of capabilities. Certainly, it starts with the patient portal and giving them access to patient records. I mean, that's like almost a de facto minimum. Like, can't you give the records to the patient? That's one way to engage them so that they can see the patient. And we know the famous people like ePatient Dave that showed that having access to your records can actually improve the care, because the patient is the best quality control for the patient record, and they can ensure that the record is highly accurate. So we need to make those available to the patient as the first step so that they can inform the provider of what's accurate, what's inaccurate, what needs to be updated, or any other changes that may have occurred even outside of that organization. So I think that's like a minimal baseline. Let's give patients access to the record and let them have the opportunity to update the record, or at least inform the clinical organization of what needs to be changed. Then going beyond that is actually communicating with them. Imagine this. Let's actually communicate with the patient. In the fee-for-service world, it makes sense why the doctor doesn't want to over-communicate with the patient. They don't get paid for it, right? Whereas in this new value-based reimbursement world, the doctor will need to have that connection to the patient in order to ensure that they are healthy, that they are compliant with whatever care plan they created with them. So I think that's going to push us to want doctors to interact with the patients and vice versa, right? So that there is that deep connection and ongoing effort to improve the care of the patient. And I think that's largely going to happen through the patient portal as well, but we're also seeing it through secure text message. We're also seeing it through telemedicine, even through mobile apps. I think there's some interesting mobile apps that are going there that allow patients to get answers to their questions.
Oh, it's interesting you mentioned all those capabilities, John, because eClinicalWorks basically offers all of those things, and we're certainly happy to talk to people about more information if they're looking for it. But you bring up an interesting fact where you say that it's going to be definitely a bigger part and a more desirable part of a value-based system, but I think it's also kind of valuable here in the fee-for-service. You mentioned that they're not reimbursed for it, so if they have to return patient calls or answer patient questions, which I think a lot of doctors feel morally obligated, if not actually contractually or lawfully obligated to do. If they're doing those things and getting on the phone and spending all that time with patients, if they could find a more time-efficient way to do all of those things, they're actually kind of saving themselves some money. And we've had that said to us by some of our clients, some people that we've interviewed for the podcast, that they've saved tons of time. It's more convenient. They don't have to spend quite so much time to communicate with the patients, but they have the same effectiveness when they use those electronic-based methods.
Well, it's an interesting point, right? And the challenge is this. Most doctors are afraid of what it means to start communicating that way through a patient portal, through a secure messaging system. And so there's this fear that makes them say, oh, I think that will be worse. Or I think I'm going to end up giving a bunch of uncompensated care if I start utilizing these tools. And it turns out the reality is totally different. My favorite example of this is a guy named Dr. C.T. Lynn out of Colorado. He did a study on this, and he did the research on it. And he literally wanted to implement a program where the patients could interact with the doctors and they could access their patient records through the patient portal. And Dr. Lynn actually took it to the doctors. And one doctor said this, which was super fascinating. He said, I'm only going to let you do this because I know that you're going to fail so badly that you will realize how bad of an idea this is and how awful this is going to be, right? And so the doctor literally was so afraid of it. And he's like, yeah, I'm only going to let you do it because I think you have research vigor. And so you're going to do it in a proper way. And you're going to realize this is an awful idea. And Dr. Lynn always replies, okay, thank you. We'll go ahead and we'll do it. And they did it. And this doctor discovered he was wrong, that it actually wasn't a huge overhead on his time and his effort, but instead it was actually a savings for him. And the doctor came back to him and apologized essentially and said, well, you're right, this is better, and I'm glad we did it.
Yeah, a lot of those, there's understandably some anxiety there. I mean, you mentioned before the very first thing is giving patients portal access, and there's some doctors who don't even want to do that, or they'll do that. We've seen doctors who've turned on the portal for their patients, but there's almost nothing there because they don't want to publish the labs. They don't want to make it possible for them to request refills because they think, like you said, it'll be an administrative headache. But then, the people that we've talked to have found, just like you said, they found almost the opposite. But that's really interesting. He almost challenged him to say, I think you're going to find it's terrible, but found it's the opposite.
Yeah, well, and I mean, what you highlighted is the problem with the portal. Everyone's like, oh, no one uses our portal. It's like, well, you didn't put anything useful on your portal. So if you don't put anything useful on your portal, no one's going to use it. But there's also the other problem. I went to my pediatrician. I have 4 children. I went to him and I said, hey, can I get access to your patient portal? Which I knew they had because they'd done meaningful use, right? Like I knew that they had one. And the front desk person said, I'm not sure. I never had that question. Hold on. She went back to the practice manager. She came back to me and she said, okay, yeah, we'll email you access to it. 6 months later, no access. But so, I want to test it, right? Because obviously I'm a little bit biased because I'm a blogger, and they didn't even know anything about it. So there's a big learning curve that still needs to happen.
Well, I think so. I think you really hit on the point there that, when we talk about engagement, engagement is a two-way street. It's not just patients being engaged or responding to these things, but it's also the office. Like the office needs to make sure that they're educated, make sure that they're putting the message out there. Because it sounds like in your case, like they had this capability, and like you said, you were an informed consumer. You knew, little did they know that you're an informed and involved guy, but they weren't prepared to even handle the request to put you on the patient portal because someone didn't tell that front office person that might be something that they're doing. So I think it really highlights the fact that to be successful with patient engagement, and again, I know I keep plugging our podcast here, but we had an episode where we talked with a practice out in, actually I think it was in Carson City, Nevada, not too long ago, and they mentioned all of the communication that they did with their patients and internal communication as well that helped make them so successful.
Yeah, when you talk about care coordination, there's a similar issue there, right? Is communicating between providers and then also to the patient. And I think that's a challenge that needs to be done and it needs to be accomplished. But no doubt, you have to have both sides engaged, and that's the real problem. There's a lot of doctors and other providers that are afraid, and quite frankly, there's a lot of patients who don't care either. And so there's a big challenge there as well.
That was part 1 of our interview with John Lynn from Healthcarescene.com. Stay tuned for the next episode, and also check out our other episodes on iTunes, YouTube, and my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Siladi, and thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.